This is Radio Health Journal. I'm Nancy Benson. This week, how coronavirus has spurred telemedicine, and doctor visits may never be the same.
The genie's out of the bottle. There's no question that telemedicine reimbursement will be forever changed. Everybody has access to a telemedicine app of some sort.
Seeing your doctor on your smartphone when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
When you are coming from a different demographic and you are a minority, it could be very challenging for you to actually succeed in the industry.
The changing face of construction in the U.S. Then,
it took about 3 hours of labor in Latin America to produce a pound of coffee.
The complicated rise of coffee. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
With most Americans under stay-at-home orders and the COVID-19 toll rising every day, it can be easy to forget that for a lot of us, our medical needs have nothing to do with coronavirus. But seeing a doctor in person these days is next to impossible. Clinics and doctors' offices are closed. So what do you do? Like just about everything else, you can still see your doctor online.
For a meaningful telehealth visit, which is coming closest to an in-office visit as possible, you actually need to be equipped at least with a smartphone or a computer that has a camera. So in other words, there should be a synchronous interchange between the physician or physician assistant or whoever the provider is with a patient.
That's Dr. Francesca Ringfell, head of Ringfell Advanced Dermatology in Philadelphia, and assistant professor of dermatology at Thomas Jefferson University. She says a remarkably high percentage of dermatology patients can be seen very effectively through a smartphone.
The things that we can do is the evaluation of acute rashes, the evaluation of some suspicious spots on the skin. If the photograph and or video interchange allows us to reasonably be able to be making a diagnosis, we can continue to provide ongoing care for our patients, treat many patients with acne and, for example, psoriasis and eczema. We can then manage and continue to manage treatment. We can even initiate treatment in somebody who has new acne.
Other than a hands-on physical examination and the ability to do imaging, virtually every other aspect of the offices that is preserved.
Dr. Brian Cole is professor of orthopedic surgery at Rush University and managing partner at Midwest Orthopedics at Rush.
We think that initially, possibly any non-emergent emergency room attention clinical condition is eligible to telehealth. So even acute injuries could be triaged in this fashion. So we obviously have to be very careful about plugging patients into the telehealth portal who might have urgent need that is truly considered an emergency that would otherwise call 911 or go to the emergency room. Obviously, there are clinical situations where physical examination would be important, so this doesn't replace all physician-patient interactions, but frankly, it replaces a lot of them and becomes a really efficient solution for patients who are otherwise driving sometimes great distances, in our case even flying, for a relatively short office visit that can be associated with a wait time just in the waiting area, and then obviously the travel back home and being away from their families and work. So I think that this is going to become an integral part of how we deliver care in the future.
Technology installed at clinics, workplaces, and schools can give faraway specialists even more information, like a virtual stethoscope for a more complete doctor's visit, according to Brian Slusser, CEO of Health in Motion Network.
What we do and distinguish, the basic distinguishing factor, Reed, is hearts and lungs. Your ability from a remote provider perspective, remote clinician, to hear the patient's heart and lungs at a distant site. And again, we see that as an actual medical appointment using a nurse on the receiving side where the patient is.
Already, telehealth has changed the face of medicine in the few months since the start of the COVID-19 pandemic. Virtual visits were certainly available, but not a big part of what most doctors did. Now they are, in large part because health insurers have decided they need to start paying for them.
Some of the obstacles before or pre-COVID were that there were reimbursement challenges. Third-party payers didn't necessarily recognize telehealth, and it wasn't really widely adopted. So now telehealth is broadly being utilized across providers, not just physicians, but potentially physical therapists, occupational therapists, and other advanced practitioners in the healthcare system.
Telehealth has not been widely covered by many insurance carriers. Medicare has in fact never paid any telehealth visits or accepted telehealth visits from a specialist office. And only earlier this year has Medicare been able to accept some telehealth visits with the primary community.
For most patients, this is a new way to see the doctor, but Cole and Ringfeld say patients are overwhelmingly happy with telemedicine.
Universally, it's been accepted with positivity and enthusiasm. I haven't had a single negative interaction with patients since we began using this.
The reaction overall that we had was only positive. Everybody understands that they should be practicing social distancing. They are very happy that this mechanism is in place, that they can bring those concerns to us. They are very happy to know that we don't have a large influx of patients to our office should they need to come in for a particular concern.
Doctors, however, are a little more of a mixed bag.
There will be individuals who say that the touch aspect is always critical, but I would imagine that in general, physicians will largely embrace this and be able to separate out that which requires a face-to-face visit versus one that can be handled in this fashion. As long as all the stakeholders are aligned, from third-party payers, the patients and the physicians, and the software platforms are working and functional, then I would say that this is going to be a tremendous advantage that will largely be embraced by everyone.
Ringfeld says sometimes telehealth visits can be a little slower than face-to-face visits, and that could make them less sustainable. However, she says there's one bigger hang-up that may hold down telemedicine once the coronavirus pandemic is over. We don't know if it works.
If there was long-term data available that showed that telehealth visits can be as effective as in-office visits, I'm sure a number of insurance companies, private carriers as well as Medicare, would see that as a welcome change in order to provide health care. It will be at a lesser cost to these insurance companies because they don't have to pay for the facility. The lack of long-term data makes it unlikely that telehealth visits become a norm, but I would not be surprised if, to a certain degree, telehealth visits might still be pushed by private carriers in general in order to keep costs for the insurance low.
However, Slusser and Cole are already convinced that we'll never go back to the way it was before the pandemic. Virtual visits are here to stay.
The genie's out of the bottle. There's no question that telemedicine reimbursement will be forever changed. The utilization, because it's been widely distributed. Like everybody has access to a telemedicine app of some sort. You're going to start seeing the race toward more advanced virtual health. You're going to see an uptick in utilization just because there's a need to talk to somebody in a remote site. But when it gets beyond that, when you're trying to manage diabetes or complex pharmacy care in any sense, it's going to be a virtual clinic that those practitioners practice in.
I will tell you that personally I will make it a substantial part of my practice as long as the tolerance is there. I believe that it has the potential to reduce the cost of healthcare, reduce bricks and mortar, and reduce the inefficiencies that are currently in our system. So I believe that this will be a silver lining in this pandemic when things settle and reemerge on the other side.
You can find out more about all our guests through links on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Blood clots affect about 900,000 Americans each year, resulting in about 100,000 deaths, more than from AIDS, breast cancer, and motor vehicle crashes combined. Hospitalization, surgery, and physical trauma are major factors that put you at risk for blood clots, according to Dr. Gregory Maynard, Chief Quality Officer at the University of California Davis Medical Center.
About half of all blood clots occur during a hospital stay or within 90 days of one. Most of these blood clots can be prevented, but fewer than half of hospital patients receive proper prevention measures. So before you're admitted to the hospital, Talk with your doctor and develop a blood clot prevention plan.
Anyone can develop a blood clot. The Centers for Disease Control and Prevention advises that you know the signs. Signs of a blood clot in the legs or arms include pain and swelling with skin that's warm to the touch, red or discolored. Signs of blood clots in your lungs are difficulty breathing, chest pain that worsens with a deep breath, coughing up blood, and a faster than normal or irregular heartbeat. If you think you have a blood clot, seek immediate medical care. Find out more from the National Blood Clot Alliance at stoptheclot.org.
It's National Women's Health Week, and the National Blood Clot Alliance and the Alexandra Rowan Foundation are urging women to give careful consideration to the choices they make when selecting a birth control method. The birth control pill is the #1 contraceptive choice among the nation's more than 60 million women of childbearing age. While experts say that the pill is safe and effective, they caution that hormonal birth control containing estrogen, including the pill, patch, or ring, can pose risks, including the risk for potentially deadly blood clots. And this risk can be significantly greater among women who have other risk factors, such as a genetic clotting disorder or previous blood clot. To help minimize their risk, women are encouraged to visit womenandbloodclots.org, where they can get a risk assessment tool to review with their physician to help determine their best contraception options, as well as information about the symptoms of potentially fatal blood clots. Know your risk and your options. Visit womenandbloodclots.org. That's womenandbloodclots.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Whatever kind of takes the edge off, right? Whether it's a drink, whether it's food, whether it's even shopping or Netflixing, I think that's what a lot of people are regressing to at this point.
Addiction in the pandemic.
Then, no graduations, no weddings, no funerals. What it means to lose our rituals during the pandemic.
It is a big deal, and it is a big deal in the larger scope of our human need to mark a special occasion.
All that and more on Radio Health Journal.